A patient can look stable one moment and crash the next. That is the danger of myocardial infarction. MI, commonly known as a heart attack, occurs when blood flow through a coronary artery is suddenly blocked, cutting off oxygen to the heart muscle. Without oxygen, myocardial cells begin to die within minutes. This is not just chest pain. It is irreversible cardiac muscle damage, and every second of delay increases mortality. That's why MI is one of the most time-sensitive emergencies in clinical practice. Clinically, MI often presents with intense central chest pain, described as crushing or heavy, frequently radiating to the left arm, jaw, neck, or back due to shared nerve pathways. Patients may appear pale, sweaty, restless, and anxious because of sympathetic nervous system activation. Shortness of breath occurs when the failing heart cannot pump effectively, leading to pulmonary congestion. Nausea and vomiting are common, especially in inferior wall MI. Importantly, elderly and diabetic patients may present atypically, sometimes with only fatigue or breathlessness, making clinical vigilance essential. Pathophysiologically, MI begins with rupture of an atherosclerotic plaque inside a coronary artery. Platelets aggregate at the site, forming a thrombus that obstructs blood flow. Oxygen deprivation forces myocardial cells into anaerobic metabolism, causing lactic acid accumulation and ATP depletion. Sodium and calcium influx leads to cell swelling and membrane failure. If ischemia persists beyond 20 to 30 minutes, irreversible myocardial necrosis occurs, reducing contractility and predisposing the patient to arrhythmias, heart failure, and cardiogenic shock. Management focuses on rapid reperfusion and myocardial protection. Aspirin is given immediately to inhibit platelet aggregation, nitrates reduce cardiac workload, and oxygen supports hypoxic tissue. Definitive treatment is percutaneous coronary intervention or thrombolysis when PCI is unavailable. Beta blockers, ACE inhibitors, statins, and anticoagulants are initiated to limit damage and prevent complications. Nursing care is critical: continuous cardiac monitoring, accurate medication administration, pain and oxygen assessment, early detection of complications. And patient education on lifestyle modification can mean the difference between survival and sudden death.